The Evidence2Practice Ontario program is supporting the delivery of care across the province by making it easier for clinicians to access and apply best practice information and quality standards at the point of care. E2P is co-led by the Centre for Effective Practice, eHealth Centre of Excellence, and North York General Hospital, and funded by Ontario Health. Disclaimer: our goal is to support clinicians with care decisions while also optimizing clinical workflows. Please consider these supports a supplement to clinical care rather than a replacement. We deeply value the work clinicians do each and every day to provide high-quality patient care. The E2P Diabetes Management Tool for Oscar Pro is designed to support the early identification of patients at risk for developing diabetes and management of patients with type 2 diabetes. The Diabetes Management Tool supports the early identification of patients at risk of developing diabetes, creation of tailored care plans, review and assessment of glycemic targets, and provides patient education and coaching resources, and promotes patient involvement and self-management. The tool supports the identification of the patient's risk level of developing prediabetes or type 2 diabetes by providing access to the CAN Risk questionnaire. The tool also features the PHQ-9, GAD-7, and WHO-5 screeners to support the management of comorbidities. For patients with an established type 2 diabetic diagnosis, the tool will support the ongoing monitoring of the patient's response to treatment related to non-pharm and pharmacological therapies, as well as the PAID screener for users to identify the diabetic problem areas. Our tools are built to support clinicians but do not replace clinical judgment. We recognize that patients are unique, and so areas of the form can be customized at the patient level, including target frequencies and goals. The tool provides access to a comprehensive list of self-management therapies and streamlined navigation of available services and supports, tailored to individual patient needs. With the focus on providing access to evidence and standards, users can expect information related to best practice and clinical decision support embedded throughout the tool. This includes the Med Reference Table, recommendations for optimizing pharmacologic treatment, information on basal insulin, 20% insulin dose reduction method, and many more. Here we will demonstrate E2P tools based on two different scenarios. The patient presents with symptoms and risk factors that lead you to suspect the patient is at risk of developing diabetes. Using the E2P Diabetes Management Tool, clinicians can efficiently complete the CAN Risk screener with the patient, interpret the results, update the diagnosis status, and record pertinent details in the Quick Notes section. Clinicians can quickly document information on the patient's labs, risk factors, symptoms, and immunizations with a few easy clicks. Another key feature is the ability to adjust the goals for weight, blood pressure, and the frequency of laboratory values to tailor the measurements to the specific needs or targets of each patient. Patient Scenario 2. Our second patient scenario is a patient who has been diagnosed with diabetes for a number of years. For a patient who is diabetic, users can screen and monitor the complications related to diabetes. Once the complications have been assessed, the tool seamlessly embeds patient resources related to complications directly after the complication section, thereby supporting a seamless transition while ensuring clinical requirements are met along with supports for patient self-management. The tool will enhance patient-centered care by integrating best practices, streamlining documentation, and providing access to supports for patient care, for example, referrals, self-management, community resources. The management of diabetes should be an interactive and collaborative effort between the clinician and patient. The focus of the tool was to ensure patient-centered supports are in the right places at the right times in the tool. The tool supports shared decision-making that can empower patients to be involved in their own care. As mentioned, access to best practice standards and evidence is embedded throughout the tool. This tool is also equipped with an interactive medication reference table. Here, clinicians can access information related to insulin and non-insulin therapies and combination products with details on starting dosages, target dosages, risks, costs, and coverage. User and installation guides are available for download on the community portal. If you do not have an account, please visit this website. The change management team will be happy to support you if you require assistance with installation. Please reach out to Evidence2Practice@cep.health. Dedicated to supporting primary care clinicians, allied health professionals, and clinic staff, the eHealth Center of Excellence offers guided tool installations and technical setup and guidance on how to optimize the integration of the tools into your existing workflow. In addition, our partners at the Center for Effective Practice can offer supplementary one-on-one discussions with an academic detailer on balanced, evidence-based information on insulin therapy for type 2 diabetes and non-insulin therapy for type 2 diabetes. With E2P, clinicians can provide enhanced care for their patients, all while reducing their own workload and stress. Try our diabetes management tool today, and remember, our team is here to help. Learn more or sign up at E2P.ca today.